Good evening. Welcome to the Safford City Council. Looks like we have a full quorum. Reminder, if you have your cell phone, would you please mute it or turn it off? It's up to you. Our Pledge of Allegiance is going to be offered by Councilman Brad Hempel. Our opening prayer is going to be offered by Councilman Arnold Lopez. Would you stand and remain standing for both, please?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Father, I want to thank you for the many blessings that you've given me, one of them to be in this county, Father. All the way from the Bridge of Peridot, the San Jose, the Bonita, Klondike, I pray for all our citizens. I pray for rain, healing, and unity, Father. And I know that you have a special heart for Graham County, and I thank you for that, Father. So I ask you to grant us all wisdom to go forward in the things we need to do with and for one another. And I ask this in your name, Father, Jesus Christ. Thank you. Amen.
Amen.
Thank you.
At this time, we're going to have our citizen comments on agenda items. Our agenda items, we're going to go ahead and start with the Mrs. Susan Smith. Would you please, when you come up to the podium, would you state your full name, your address, and once again, I'm going to address this a couple of times tonight, but please remember that it's a 3-minute limit, okay?
It's a privilege to speak with you today regarding the management of Graham County's response to the COVID-19 virus. My name is Suzanne Smith. I'm a resident of Safford. In addition to my nurse's training, I have been trained in the management of an epidemic. I am the founder and the chief nursing officer of International Health Scout, a health science system that is now being used in 74 countries. In my role as a leader in global health education, daily I am responding to requests for advice globally. This evening I have come to help my community, not as a politician, but as a health educator. Let me begin with a simple story of an unjust father. He discovers one of his 8 children have broken a teacup. He assembles his children, and all the children get spanked. The children learn that their father is unjust, and they then hide information from him. The relevance: to inflict on the grief on the majority to benefit the minority is unjust. In over 45 years of healthcare experience, I have cared for many vulnerable patients, immunosuppressed, with no bodily defense against diseases, people on chemotherapy, those with organ transplants, blood cancers. At one time, I worked on the heart transplant unit at the University of Arizona Hospital. The correct and effective approach we teach vulnerable souls is to avoid exposure to diseases, avoid crowds, wear masks, maintain good hygiene, and maintain their health at the highest possible level. The vulnerable patient must take responsibility for their own health. The design and properties of the ever-mutating COVID-19 virus creates another risk for those already at risk and an added vulnerable group, an additional group. You will wonder why you have not been told this before. It is because it's not politically correct, although it is real science. Around the world, countries such as the United Kingdom speak boldly of the disparity in the ethnicities of the lion's share of the victims of the virus. The most effective genetically linked are people that are genetically linked to the Mediterranean Sea area and of African lineage. When the virus numbers are released in the U.S., the ethnicity of those who are affected is withheld from the public. This doesn't happen around the world. This is not happening in other countries. The mayor of Tucson, within the past 72 hours, ordered a study of Tucson zip codes, which are the most effective. Looking at the many zip code areas, those that dominated in the virus reports are the Latino neighborhoods and the U of A. I salute her. That took courage. So, who is at risk? Those with known vulnerabilities from pre-existing conditions. Those with genetic ties to the Mediterranean Sea areas and Africa. Those over 60, obese, with diabetes and high blood pressure. The public statistics are faulty. We are the hub of 40,000 people. All these people have not been tested, so there is no solid number of how many have been affected and how many have antibodies. And 95% of the people affected have not even slight or any signs or symptoms of disease. These are only discovered with antibody tests. The information that our health department believes is not up to date. The current information is, according to studies, 2 studies by the National Institute of Health in Great Britain and in Canada show antibodies 6 months past the active infection, not 3 months and diminishing. 33 deaths are sad, but it is a minuscule number when you compare it to the 40,000 people that do business, live here, do commerce, come here for church, and their medical needs and their education. It is a minuscule number. But how many have died in the past 10 months from drunken accidents? Maybe we should all stop driving. We have some drunken drivers that have killed people or killed themselves. There is a large number that are dying. Collateral damage from the management of the virus is not the infection. There is a significant increase in depression, anger, anxiety, suicides, domestic abuse, overdoses, locally and globally. Medically, conditions are not being attended to, tests are being put aside, procedures are delayed or canceled. In medicine, the first rule is do no harm. So what can we do?
Mrs. Smith, are we about to wrap it up where you're actually about 30 seconds over 5 minutes?
I'm sorry, I
Could
couldn't
we
hear.
wrap it up?
Yes. If you want to know if you're at risk, call your doctor. Encourage those that are at risk to accept responsibility for their health, including home-delivered pharmacy, groceries. Take advantage of senior shopping hours. Conclusion, we must open our society, economy, education system, allow breadwinners to go to work, patronize the local businesses. If you manage a retail store, keep it clean, open the doors, let the fresh air in, and resume social and religious activities. Thank you.
Thank you.
Can we have your address?
Yeah, 1535 West Thatcher Boulevard, number 226.
Thank you.
It is in Safford.
Oh, yes.
Thank you. That'll bring us to Dr. Susan Jones. Once again, when you come to the podium, would you please state your full name and your address, please? And once again, do your best to limit it to 3 minutes, please.
I think I'll be under 3 minutes. Hello, I'm Dr. Susan Jones. I know most of you, but not all of you. I live at 1146 South Chelsea Lane in Safford. I am a family physician at Gila Valley Clinic. I'm here representing the 7 MDs and the 4 nurse practitioner and PAs that we have now at Gila Valley Clinic. We have 45 employees. We just want to make you as the council and leaders of our community aware of the concerns that we have. Suzanne mentioned a lot of them, but in brief, according to as we look at the local thing, in our clinic we are seeing a huge surge. As some of you know, we got a tent about 3 or 4 months ago so we could do the testing safely, so people who are sick or exposed don't come into our clinic. We were testing everybody every afternoon, about 10 or 12 people. In the last 2 weeks, we're now testing 29 to 32 every day. We have a 20% positivity rate. So not only are we testing more, but our percentage has gone up, and that's true through the whole state. So our clinic is being overwhelmed. Besides taking care of people, trying to take care of their diabetes and their high blood pressure, the kids getting their shots, which now it's not even necessarily safe for them to come in and get their immunization. We have all these people who have COVID. The hospital is getting overwhelmed. Some of you may know, we had 17 patients in the hospital with COVID on Friday. That's a normal census. Normal people, normally we have 17 to 20 people in the hospital in a day. We had 17 with COVID on Friday. We have 14 today. That's on top of the usual patients. The hospital is not, I take care of patients at the hospital, as do all my partners. We are not going to be able to care for the COVID patients and the people who come in with regular illnesses that need care. We had to make another ICU. It's only an outpatient procedure room. So patients who have COVID and are in the ICU, it's not safe to put regular patients with the COVID. It's totally isolated. It is a HIPAA filter room. So that people with diabetes, with arrhythmias, who need to be in ICU, sepsis, are in an outpatient procedure room because that's the only place we can put them. Our nurses and in our staff in our clinic are out because they're quarantined or their kids brought something home from school or their spouses from work. We have numerous people out, and so they're working extra shifts. They're pulling nurses from the OB floor to work on the med-surg floor because we don't have enough nurses. And my concern is in the county, as you've seen the numbers, we're at almost 500 active cases in the last 14 days, 495 today, active cases in 14. That's over twice as many as we had in the surge in July. If we are just concerned if we don't do something, that these numbers are going to cause concern in our cause problems in our healthcare. We're not going to be able to take care of patients with regular illnesses, let alone the patients with COVID. And there won't be any place to send them because the hospitals in Tucson and Phoenix are going to be just as full. We feel that it's reasonable to ask for a mask mandate for a limited amount of time. A mask mandate and a social distancing will make a difference. It's going to cut the edge off of that curve. It's going like this right now. If we can top it off and start to come down in 4 to 6 weeks, it would make a huge difference for our community. It has been shown. There was a study out of BYU just released. They looked at 115 studies. It was a review article, 115 studies with masks, and their summary was that masks do make a difference. They're not 100%. When you wear a mask, you are keeping your germs, your virus, from going out. We don't know who has it, just as Suzanne said, we don't know. And when people go into our local businesses without a mask, they're being disrespectful. Those people in the businesses, in the hospital, in the restaurants, and the grocery stores, and Walmart, they wear their masks. And somebody walks in without a mask and exposes them unknowingly, they can't afford to be off for 10 to 14 days without a salary. So people who are not wearing masks are being disrespectful to those people. We don't need to close things. We need to wear masks and socially distance, and we can make a big difference. And if we don't, we're going to be closing things because there's not enough people. The stores aren't going to have enough people to run their businesses. The restaurants won't have enough waitresses. People are going to be out, and it's going to hurt our economy. Whereas if we can cut the numbers down, not only will we help the medical needs of our community, but we will help our economy because there's going to be more people able to continue to work and get their paychecks. Thank you.
Thank you. All right, that brings us to Mr. Paul David. Would you come to the podium and state your name and your address as well, please, and do everything you can to be 3 minutes?
Thank you, my friends. Paul David, and my address is 953 West 16th Street in Safford. And I think you can hear me okay, but I'll take my mask off at the risk of getting COVID, but for clarity. The reason I'm here tonight, as I am chairman of the Board of Supervisors, but I have not been authorized or asked to represent them tonight, but I am representing myself as a citizen of Safford and also someone who is fairly aware of the situation and is a member of the Board of Supervisors and has attended meetings. I have delivered a number of several addresses, brief addresses, and I'd like the board members to know that I was asked about 4 or 5 months ago if the board was asked if we would have a mask mandate. At that time, COVID seemed under control. The idea of personal liberties, we were seeing states where they were closing churches, closing buildings, closing all kinds of facilities, and I felt that that was an overreach by the government. And I was opposed to a mask mandate as part of that overreach. Situations have changed a little bit. COVID has gone from being something that has been manageable. We've had the capacity in our hospitals. Our health department director has indicated that social distancing and people who are wearing masks and treatment that we pretty much had control, but that's no longer the case. You might be, it's interesting, it's almost ironic. Brian Douglas, who works with Matt Bowling, who's an epidemiologist in Greenlee County, Brian can't be here tonight because with all the care and all the knowledge and all the wisdom and all the precautions, he has 3 members of his family who have COVID that live in his household, and he and his wife are in quarantine and working. He's working remotely for the next 2 weeks. At the risk, I said, can I share that, Brian, because I didn't want to have a HIPAA violation. But isn't that, it just goes to prove that anybody is susceptible, anyone can get it. My last point that I'd like to make is I am in favor at this time of a mask mandate. I think that we've had a couple of meetings where people have suggested up to 6 weeks. It's temporary. It's not like some of the other mandates or asks. We're at the end of 6 weeks, we would take a look at it. I think most people would, in businesses, if there's a finite, if this was going to be from now on, I would have severe reservations. But 6 weeks is a good look-see, and if it's effective, then we can all get back together, the Pima, Thatcher, Safford, and Graham County. And I was thinking of the political costs. Because people are so divided, you supposedly are nonpartisan. You don't run on it as a Democrat or Republican. I do, and I'm thinking, but we still have friends who have strong feelings about mask mandates, and I can promise you that the people who have contact you and say, "Could you please do this?" and then they go on to become sick or have a family member who passes away who is critically ill, those people are going to remember you at the ballot box long after the friend or associate who says, I'm not really in favor of it, I wish you wouldn't do it. There's a cost for every decision, and I would encourage you, because of the suffering, the expense, the misery, and the weariness of our healthcare workers, to consider strongly. And I can't speak for the rest of the board, but I can tell you that I will do everything that I can to persuade the other board members and to see if they will join you. And I know the town of Thatcher and Pima have already indicated that they'll be passing resolutions in support. So that's all I have to say. Thank you very much. If you have any questions during as you go through the agenda item and discuss, I'll be glad to come back up. Thank you. Thank you, Mayor Council.
All right, that brings us to citizen comments on non-agenda items. Dr. Phelps, and go ahead and come up to the podium and state your name and your address, please, Doctor. Thank you. And remember, do everything you can to maintain 3 minutes.
Okay. I'm Dr. J.A. Phelps from Sonoyta, Arizona, PO Box 629. And most of you are aware of the misery I've had for the last 21 months trying to get permission to use my property to build an animal hospital in Safford. We've run into some real issues, and I think I have a solution that will solve my problem and allow the city to do everything that they want to do with their text amendments. If I can just meet with the Board of Adjustment, which I just found out who they are, as most of you have just become aware of who the Board of Adjustment is. So I'm simply here to ask that the Board of Adjustment put me on the agenda for a meeting, which I know they're not scheduled, but hopefully it'll be an emergency meeting. That's all I need. Thank you.
Thank you, Doc. And John, will you please write that down and get back to me and let me know all of the rules and stuff to where we can make this Board of Adjustment happen? Thank you. All right, that brings us to item 7, new and old business COVID-19 update. Vice Mayor, this is your agenda. You want to go ahead and take it?
I'd be glad to. After hearing the presentations, from Dr. Jones and everybody, and I think it was Friday or Thursday or Friday, we were at the General Service Building and had a presentation there. It was very informative. It said a lot about everything, what we need, kind of like Dr. Jones mentioned. Our system's getting overwhelmed. That concerns me. I know at the meeting, I made the mention that the elections are over, so now we have to address this with taking our citizens. They're number one. We have to take care of them, make the right decisions, whether we're in favor of a mask, we like them or whatever. Forget our personal feelings and think about our community. A lot of times people say, well, Safford's a leader. Well, just so happens we're not. Thatcher's leading already. Pima's having a meeting tonight to adopt or recommend adoption of a resolution, on a mask mandate. The chamber is supporting it. Our schools are supporting it. Everybody's supporting it, and I think it would be a shame if we ourselves don't take it to heart. And I, for one, am proposing that our council schedules a special meeting as soon as possible to adopt a resolution supporting this mask mandate, sending it to the county.
Okay,
John, I would need a second on that, then we can have more discussion.
we can't have that. This is only for information, discussion, and direction.
But as far as the meeting goes, I could, I'd need a second for that. Is that right, John?
Mayor, Council Vice Mayor Ortega, you would need 2 council members to agree to have a special meeting.
Okay.
Yeah.
I agree with Vice Mayor Ortega to have a special meeting.
Okay. So be it. You can have a special meeting. Go ahead, Gene.
I just have a question. This isn't a Safford problem, a Thatcher problem, a Pima problem. It's a Graham County problem. And as I understand, the councils that are meeting are, and I'm not privy to their agendas or anything, but understanding from what I've read is that they're merely drafting a letter encouraging the county to pass a mask mandate. And if it's a county issue and if it's a serious problem, which we believe that it is, I don't know why the county can't just do whatever they feel is right. I don't know why every jurisdiction and the schools have to write a letter encouraging them to do what they apparently feel is the right thing to do.
I'd like to respond to that, okay? I think it would be, we have to act as one. We have to be a county supporting this, so there won't be anybody saying, no pointing the fingers. This is one time that we as a county have to, and cities, have to pull together for the betterment, for the best interest of our citizens.
Councilman Steele, were you finished?
Yes.
All right, so, you know what, as far as I'm concerned, we can have that special meeting. You can get together and try to find when a good date's gonna work, so you can get a majority of the council there.
Okay.
And with that, I don't think we need anything else.
We're not gonna hear from Melissa?
Do you want the presentation?
Well, I think Mayor Couts and members of council, I think just for the sake of getting an update from the county, since they're the authority, just to inform everybody. Not everybody was at the meeting
Okay.
on Thursday, and so I think it would be beneficial to at least let her make a presentation.
Okay, perfect.
We,
Go ahead.
you used the word the county's the authority. They had a meeting the other day I thought was gonna last a half hour, and it went for 2 hours, and nothing really became of it, except that they were gonna have a news blitz, and they were gonna wait for the towns and cities to come up with resolutions before they would act. Now, that is kind of a form in that meeting of kicking the can down the road. So I was looking for leadership to come out of that meeting, and I didn't see the strength that I thought would come out of there. And so we're gonna have our special meeting, and I know too, this is a serious matter, but there's plenty of finger pointing that can go around. You know, are the facts right? Is everything going good? My daughter-in-law today, she went and had antibody test, and she was at my house. She got called from Phoenix and said, "You need to isolate, you got COVID." She said, "No, I don't. I have the antibodies." It wasn't a half hour later, our own county called her and said, "You have COVID." And so, you know, what can you believe, what can't you believe? I believe people are dying. That's what I believe. And something needs to be done, and we need to work together. But some together don't seem to be all the way yet. The educational part of all of us is definitely needed. We need to educate everybody. I don't want businesses to shut down. They do run themselves, they do have masks. You go in, if there's a place that has a mask, I wear a mask. And so, you know, so I'm torn between how are we gonna enforce it? How are we gonna get people to do it? That's still the clarity I hope we gather from any other meeting to take place. But, you know, I'm, Mr. Hempfield and Vice Mayor, you know, have that meeting so we can, as us, try to do what we can for our city boundaries and not wait on anything that was political.
Mayor, I have a word to say.
I think do we want to
that-
keep discussing this, or do we want to have a presentation?
Or I just have something short
Go ahead.
to say. I would just ask for in the interim, people to be respectful, wash your hands, and physical distance. That's all I would
Okay.
remind people to do.
All right, perfect. Health Department, I'm sorry, HR. Health Department, will you please come up and give your presentation?
My mask down because I don't have the loudest voice. So Brian, I am representing Brian tonight, and he wrote some things that he'd like me just to present, and then I just have a little bit to add. Due to the recent increased number of positive COVID-19 cases with Graham County and the influx of positive COVID-19 patients admitted to Mount Graham Regional Medical Center, the Graham County Health Department is recommending to our community leaders to implement measures to slow the spread of the virus. As such, the Health Department recommends an ordinance for mandating masks, or in lieu of mask mandate, a strong marketing COVID-19 campaign in partnership with our local municipalities to raise awareness throughout the county. In addition to collaboratively help slow the spread of COVID-19, it is our recommendation to carry out strong mitigation measures with large gatherings and events within our communities. These mitigation efforts are proven strategies to help slow the spread of COVID-19, including social distancing and good hand hygiene. Another indicator that can be utilized to confirm our increased numbers is the Arizona Department of Health Services benchmarks. The benchmarks were developed for the COVID-19 dashboard used to determine the level of community spread of COVID-19 in Graham County and assist with decision making. At this time, I would like to explain the different benchmarks for clarification. For the past few weeks, Graham County has the highest case rate per capita in the state of Arizona. This is over 5 times the moderate spread rate for new positive cases. In addition, our positivity rate is also the highest in the state and will increase substantially in the foreseeable weeks. Back in August 9th and 10th, that was the highest admissions that we had that were COVID admissions to the hospital, and we had 7. And now, as Dr. Jones said, we had 17 on Friday. We've had to transport 14 people out of our community for higher level care that had COVID over the last 30 days. and then I brought an article. It's a study that was done out of Kansas, and they compared their counties that participated in the mask mandate and the counties that chose to not participate in the mask mandate. And there's data there that proves that it has helped in the state of Kansas. But the author of this article said, "We're all exhausted by this virus, but the reality is the virus doesn't care. All it looks for is the opportunity to move from person to person, and a mask is a harmless, cheap way of slowing it down." And we've been working at the health department since February on this, and we've been working 70-hour weeks, and I don't know how much longer we can keep this up. But I just keep looking at it thinking, at what point is it a liability to not try to do something to prevent this or to slow it down? Because as we see that today, I counted the new cases before I came. We're going to put another 75 new cases on the board tomorrow. That's the highest number we've had. What we're doing isn't working. And the heartbreaking thing is we're going to lose some valuable people. Thank you.
So I have questions for you. Would you
Sure.
please stay there?
You bet.
How do you collect the parties being tested? How do you collect who they are and where they live?
So there was the testing blitz that Canyonlands had. It was a drive-through blitz on Saturday, and anybody could come, and it was free. And so nobody was told to come. It was just you could come. And as we've done these blitzes in the past, the plan was to drive our positivity rate down. And we had very good participation. But our positivity rate is so high that people come because they're sick, they're having symptoms, and they can't find a place to get a test. And so they're coming to the blitz to get their test.
I guess what I'm asking is, how do you, like, if I come in to the health department and get tested, do I fill out a piece of paper that states my name and my address?
Yes,
And
because I need to get back in touch with you with your results.
so does it say my physical address as well as my zip code?
Your zip code is on there, and you can
'Cause the
choose to put your P.O. box or your physical address. It doesn't
The reason
matter.
why I'm making this is because we as a council, we're over approximately 10,000 people in the city of Safford limits. That's our constituents as well. I know the county's over the county. But as I see the tests, every time I open it up every day, I cringe at the numbers. And I see Safford's almost always on top, and I'm like, ugh. And then I come to the realization that Safford, which is 85546, covers such a vast amount of land mass.
Right.
When truthfully, Safford's not as big as that. And so I didn't know if there's any way you could narrow that down, because I did notice the last 2 times you guys produced the information out that you added Fort Thomas, and you hadn't been adding Fort Thomas before. So the last 2 times, I believe it was today, so it's 3. So I believe it was Saturday, Sunday, and today you guys had added Fort Thomas.
That's correct, because
So-
when we have a zip code, when we have a Fort Thomas, then Fort Thomas makes it. But we don't put a 0 when they don't have a case.
Okay.
But I know that the geocoding is an issue, because if you look at the PEMA geocoding, it takes in all of the reservation.
Right.
And I've gone to the state and asked them if there's any way we can realign the geocoding. And if we didn't have COVID on the table right now, I think we could do something about it. But unfortunately, our resources are used to try to take care of the COVID. And after COVID, maybe we can work on our geocoding.
Okay. So that was just my question, is because every time I do open that up, I see that, and I do cringe,
I know.
And then, of course, you see sometimes San Carlos beats us.
Right.
As far as Safford is concerned, and that, and so as I process that, I'm like, okay, I want to make sure that if we could ever get what Safford's numbers are, and I realize that Safford has the vast majority of the business and stuff, so anyway, that was it, and you answered that, and I appreciate that. Anybody else have any questions for the health department?
I would like to say about the San Carlos numbers, the difference down there is they mandate everybody get tested. We don't do that. You can get a test or you cannot get a test.
Right. And they also have mask mandates, though, as well, correct?
Right,
Okay.
right.
Councilman Seal?
No, not really a question, but that's kind of what I was referring to before, that a lot of this is in the unincorporated areas of the county. And so if Safford, Thatcher, and Pima, that doesn't take everybody into account. And so it needs to be something done on a countywide basis rather than each individual jurisdiction.
I really think that something will come through with the county also. I'm very hopeful that we'll do something that will be able to prolong our ability to have the freedom to go out and do what we want to do, but at the same time keep people safe. But if we don't come together united, then it's going to be very difficult to enforce. But I think the county will come on board, and if the municipalities, if it were united in it, I can see a good outcome.
I also believe that the hospital, when they spoke at our meeting, they asked for 6 weeks. And when I had a meeting with Brian one-on-one, I won't tell you what his thing was until you tell me what you're predicting, what you would propose to us if we were to have a time frame on it. And I want to see if you two are meshing together, if you two have difference of opinions on that time.
As far as how long to have a mask mandate,
Yes.
or what our disease looks like? I really haven't talked to Brian about a length of time. I'm happy for whatever we can get, actually, because we were on a pretty good trajectory when people were wearing masks. We really were, and it looked like things were going to be okay to open school. And even though I had this dread in my stomach, I thought we were going to be okay. But right now, we're just not there. It's got the best of us.
Okay.
Thanks.
All right. Anybody have any other questions? Go ahead, Vice Mayor.
There was, I think when we're talking about the time and all, when it was brought up that, like 30 days, that way anybody infected, it'd run the course and it'd kind of give us a truer reading with it. Is that the way it was?
It was 6 weeks.
Yeah.
That's what the hospital presented.
Yeah.
The problem with this virus is it multiplies exponentially, and there's a lag time, and whatever we do right now, we're not really going to see the benefits of it for at least 4 to 6 weeks, and then we're just going to start to see the tip of the iceberg.
Good, thank you.
Go ahead, Councilman Lopez.
I want whatever we do to be successful. Not everybody's gonna be happy about it and stuff, and I know you're under a lot of pressure. I put a lot of stock in what Mr. Douglas has to say. And so, but there's some people that want to find trust in us, and the last time he said the test was 60% accurate or stuff. Do we have any new tests
Yes,
now
yes, we
that we
do.
can put out there?
We have a rapid test that you get results in 15 minutes, and it's 96-point-something% accurate, and really close to 97%. In fact, that's what we're doing for our college students, because, I was so focused on protecting our campus, I didn't even think about protecting those families that they're all going to go home to for Thanksgiving. And now we had, I think, 17 cases in the last few days on our Eastern Arizona College campus. And I was very concerned about those kids going home for Thanksgiving and taking it to their families. So we're doing a testing blitz tomorrow in the parking lot for any college students that want to get a test. We hope that the ones that come are the ones that have been exposed by a roommate or that have symptoms. But we want them to know if they have it so they can either decide to quarantine in their apartment, or at least if they go home they can isolate. Because I didn't even think about protecting their families that are out of our area. But we know what it's like to be on the other side of imported COVID, and I don't want us to be exporting our COVID to the other families in the other counties.
Okay, I hope we gain confidence of the community, because a lot of them think that mass punishment that we don't know what we're doing. So we're throwing a blanket on the whole deal. So, I hope all this will work together, I'm pretty sure, somehow, some way, but we got to gain their confidence.
Thank you.
Thank you. Any other questions for the health department? John?
I'm just curious.
You have a
Aaron.
question for the health department? No, I'm just
No,
kidding.
no.
I'm trying to make light, something to laugh about.
If I put together a special meeting, would we be available like on a Wednesday, or do you want to wait till next week on Monday? What?
I think you're gonna, I can't agree to anything right now. I think you ought to send us out an email and try to get us to respond that way, because right now
Okay.
you'll have such a mixed,
The one thing I would encourage is that we have it as soon as possible to direct it, to give, to put it in the county's hands. So I would suggest as soon as possible.
and I think at that same time, that would be a good time to also have the Board of Adjustment meeting. So, all right, we're gonna move on to item 7.2, which is the PSPRS unfunded liability, and that will be by Mr. Douglas Hill, which will be our, Mr. John, our manager.
Good evening, Mayor, members of council. Unfortunately, Douglas was once again exposed to COVID, and this time he actually contracted it, so he is once again under quarantine. So I will be making the presentation again. If you recall, at the last work session, I did make a presentation on the unfunded liability issue with PSPRS. There were a number of council members that weren't there. Since that time, we have further looked at the numbers and made them more up to date. And so what I wanted to do tonight was to provide another presentation. It's very similar to the other one, but it's a little bit different at the same time with some more up-to-date numbers. So if you'll bear with me while I try to pull it up without shutting everything down. All right. Okay, so, I'm assuming we're all familiar with the PSPRS issue and the unfunded liability that we have. And it's obviously, it deals with the public safety retirement system. So over the past 20 years, the performance of the fund has been subpar, and that has been a combination of economic downturns and also questionable investment policies by the state. In an effort to fix that, the state has gone out and essentially changed out a lot of the key personnel, management staff, and also there's a new actuarial firm. Currently, the unfunded liability that we have as a city is $12.7 million. So this breaks down the liability that we have. The top line, the 31%, shows our assets. That's that portion that is funded. The second line is the unfunded, as I mentioned on the previous slide, 12.7. And then there's also a charge to Safford, the 7%, we call it the rate of return for the unfunded liability portion. So that portion that isn't funded, that's out there at the state that says these monies have not been received by us, they're anticipating a 7% rate of return. So every year that those monies are not available, they charge us that on the portion of the unfunded liability. And again, this doesn't look the way it does on my screen, and I'm not sure why, but this is a very busy history of our actuals dealing with the unfunded liability. So if you look, this top section is basically the two portions. This is the asset portion that we were talking about, and you can see the 5.6 million, and you can see the growth in the assets over time. This is the unfunded. Here's the 12.7. And again, this is the growth in the unfunded over time. And then this is simply the total of those two lines showing the total fund for PSPRS. So what we did, and again, you can't see it for some reason on the screen, but this line here in the center in bold shows that unfunded amount. This line here shows the actual money paid by the city every year towards this unfunded liability. And what you can see is that the amount that we've been paying over time has gone up, and so has the unfunded liability. So even though we're paying more, it continues to grow. And you can see there's a large number here, and then it kind of drops and begins to climb. I call it rescheduling. We extended the time frame on the payback for the unfunded liability. So at this point, we had hit a peak of 800,000, then we extended the time frame. So the amount of payments went down for a while, but again, you can see them starting to go back in again. So the whole point of this slide is simply to show here's the unfunded liability over time growing, and despite the fact that we've increased the payment to it, it continues to grow. So basically, what we brought were two options. Option A is to follow the actuarial plan, the new actuarial plan as supplied by the state. And the second option is to use a bond. And that is something that now is, because interest rates are so low, it's become an option that communities across the state are starting to take advantage of. Flagstaff was one of those. I think Pinell County recently did something. So if we look at those options, PSPRS funding option, pros, smaller payments in the early years, although they're essentially the same. They're slightly smaller, but you'll see a graph later on that'll show you the payment schedules for both of these options. The cons, the unfunded liability carries over many years, and this really is the key, really, because you're carrying this unfunded liability that continues to accumulate that 7% interest every year if you don't pay it off. So you've got this large, almost $13 million that this interest rate is being applied to. Of course, you have the risk market variations, and you have that no matter what anyway, and then large payments in the outer years and a higher overall cost. And you'll see that the payment schedule, it goes up significantly in the out years, and of course, the total cost to the city is much higher. The bonding option, because interest rates are low, this gives us a gap between that rate of return and the premium on the bond. Predictability in the payment schedule. Again, if you have a bond, then you basically set the payment schedule for that, and you will know every year what your payments are going to be. With the unfunded liability, you just don't know. And again, the most important issue of all, that unfunded liability gets eliminated out of the gate. So what happens is that you're then left with dealing in real time with managing PSPRS like you would manage ASRS. And then, of course, the bonding cost is the con, although they're not significant, there are costs associated with doing the bonding. So here's the graph, and this rather mountainous looking line here is the PSPRS actuarial schedule paying off the unfunded liability over a 28-year period. This, I don't even know if I would call that a color. This line here, this flat line, is the bond. The new model, now this is different than what we showed at the work session. We reduced the payback period that currently we have is 28 years to 25 years. The PSPRS model over that period is a $38 million cost. The bond, instead of 4.11%, we have 3.35 is the new number. That would cost us $20 million over 25 years, and this is still 28. And then you would save over the period of that payback $18 million. And for some reason, there we go. So again, the total bond amount, $13.6 million at 3.35. Again, this is an estimate. As we go forward in time, those rates can change. So this is right now what we're looking at in terms of the best estimate we have currently, 25-year payback. Again, smaller annual payments that would increase. And again, I think if you look back, you notice that in the beginning, the payments are very similar, but very quickly the PSPRS number goes, it's in the millions here at the end of this life cycle. So whereas the bond, you're looking at about 5% increase over 5 years. It will level off at an average payment of about $822,000. And again, remember that the unfunded liability that we paid out in 2020 was $775,000. So the difference is what will impact our budget between the 775 and the 822. And also remember, and again, this amount of 775 over time, that amount has increased. So at some point, if we just continue to pay, those lines would cross and the bond would actually be less expensive. So again, the difference between those two numbers would diminish over time. Also, in most of the bonds that have been put out there, there's a reserve fund that they put in. So they'll bond for the amount of the unfunded liability, and then they'll put a reserve amount to the side that will cover if there are significant changes in the market that would once again impact the reserve or impact the fund. So in the case of other communities, what they've done is they've made that part of their bond issuance. And our recommendation would be to take the money that was freed up by using CARES Act funds on police salaries and put that million in a restricted fund balance as part of the general fund. It would be restricted and set aside to be used for any large fluctuations in the market that would impact repayment on the bond. And again, I've already stated this, that, you know, you're not paying $822,000, you're paying the difference between that and what you're currently paying. And again, the cost of the bond over time, or the repayment schedule of ASRS would go up over time, so it would very quickly bypass the bond payment that you would have. And again, this is really, really important to understand. Both the PSPRS system and ASRS are both managed in real time. Right now, we find ourselves doing two things. We find ourselves dealing with the unfunded liability and managing PSPRS in real time. So even if we pay off the unfunded liability with a bond, you still have fluctuations that could potentially occur going forward, as you would with any other retirement system, right? As the market performs or doesn't, we will have to make adjustments in the amount of money we put in, but you won't be dragging that $13 million unfunded liability behind you. And then, of course, the other benefit of this is that you're not carrying a balance, essentially. You're not, even if you chose another method to pay off the unfunded liability, by paying it off with a bond, you get rid of it up front. So otherwise, you're still, even if you're paying it off by some other means, let's say we increase the payment, or, you know, some communities have actually, you know, put a special tax in place to be made specifically for that, and I'm not recommending that, I'm simply saying that's an option. Any of those methods carry that unfunded liability. The only one that gets rid of it up front is the bond. So basically tonight, what we're trying to do is get some direction from council. If we decided to go forward, we would make it part of the upcoming budget cycle, because we don't have the capacity in the current budget year in order to fold this in. Remember when we talked about the budget, when we passed our tentative budget by state law, whatever that ceiling is on that budget, that's the maximum amount of money we can spend. Now, we can move monies around within the budget and make them available, but given the size of this particular item, it just, those monies simply aren't available. So what we would do is we would make the issuance of the bond part of the 2022 budget cycle. And then as we move forward, we would get a bond rating and then prepare requests for proposals. And of course, we would come back to council at some point in the future if we were going to issue a bond, and it would be brought back to you for approval at that time. So even if you give us direction, kind of like the WIFA loan, at one point there was a resolution that said, yeah, go ahead and check this out. And then once we do, we would bring it back to you, and then you would have another, it would be available to you again. Before we actually did anything, you would have another opportunity to go to say yay or nay on it.
So if the council was to say, we recommend a bond, does the bond have to go before the public, or is this a non-public bond?
It's a non-public bond, Mayor.
Okay. So then my other question is, if we were to pay this off, that just covers us from failure to pay to begin with, or whatever, however you want to make it sound, and then we still are going to have it going forward for any new hires or anything that comes up from there on. So we'll always have a PRS or PSPRS monies going out. Depends on hires, correct?
That's correct.
And so I'm trying to understand, because as I get letters from other mayors and stuff that have talking about, some of them have jumped on to do exactly what you have said, but others are trying to hold off and encourage this not to happen, because then it puts more pressure back on the legislature to act on something. So if we were to, I mean, once again, we don't have a crystal ball, and asking legislature to do anything is virtually nothing. I mean, it's hard to get through. But if they were to pass something and we paid this off, we lost out on that. What was that money? It's 13.7 mil. Versus where if legislature would listen to this at least and hear the cities and towns out and figure out a way that they could help with this issue, because I don't believe that it was created by, like, for instance, our city. I think it was created by, enlarged, their bad management. I don't know if you'd agree with that statement or.
In part, Mayor Couch, that's correct. I mean, there
And
were some
so,
questionable
to me, they
investments.
should be actually kind of taking a lead on this, but again, they're thinking, well, we're just gonna get it from the cities and towns. So I would be cautious on how fast to jump on this. But at the same time, I like what you had presented, because ultimately I see the savings, and so that helps draw me that direction. But I really, really want them to do something, and they are very good at dragging their feet. But anyway, that's my few cents. Anybody?
I just had a couple
Councilman
things.
Sill?
Every year, the League of Cities and Towns, there's a resolutions committee, and resolutions are made to be presented to the legislature or for consideration. And I've been to those meetings for the last 8 or 9 years, and
You've done really
this
good
is-
at that.
This is probably something that ought to be on a resolution, so that all the cities in the state can weigh in and try to put some pressure on the state. The other thing is, I guess, John, a question for you. We've borrowed some money for different projects that we've had, and we've gotten very good interest rates on those. So when a bank looks at us for funding for a project, this unfunded liability, is that taken into account as far as liabilities that we have that would influence their decision? Is that unfunded liability looked at?
Mayor Counts, Councilman Seal, I would imagine as part of their financial assessment of the city, it would be looked at.
But a bond definitely would be, is that correct?
That's correct. Because the bond would be part of our debt profile.
Right. So we would have a $13 million debt that may be looked at where we're not quite so sure that they look at the unfunded liability the same way.
And Mayor Counts, Councilman Seal, and that's kind of a double-edged sword, though, because they may see our action on this as being financially responsible as well. So it may be that, because our numbers right now in the general fund are pretty good in terms of our revenue stream relative to our exposure in terms of debt. Really, the main one we have right now would be the police station at this point. There's some other ones, but they're relatively small. So there's also that idea of being financially responsible and stepping up and showing that you're taking care of it. And we're financially, we're viable in that regard. Our numbers look good and we could take this on. And again, remember that you're already paying $775,000 a year and you're just having an increasing level of liability. If you increase that just a small amount, you're now reducing that liability over time in a consistent way. So they also, I think, would look at that as well. And Mayor Counts, getting back to your point, at this point, the legislature has showed no interest and no one is, and again, I think it's a point well taken. But again, remember that the longer we wait on this, the bigger this number is going to get. So I'm not trying to force that issue, but I think there's a reason that other communities are doing this. And one of the reasons is that interest rates are very low. So if interest rates rise, this option becomes less viable. Now, in the short term, I don't know that we see much of a change in interest right away, but we have a changing administration with different policies. We don't know what the post-COVID environment's going to look like if the economy ticks up the inflation. So the farther out we go with this, the more risk there is because there's more uncertainty.
And you said that possibly, you mentioned something about the CARES Act fund being used for some of this. What was the CARES Act? Remind me again what the CARES Act fund was given to us.
So
was that for COVID?
Yes.
Okay.
Mayor Counts.
So that was so I would ask that we hold on to that money. If the council directs you to go to bond, I would ask that we figure out a different way of getting there without using that money, because as you heard tonight, that we're not over this.
Okay, just again, a reminder, Mayor, Council, and members of council, that the CARES Act money has been used already. So the CARES Act funding went to pay police salaries. That act freed up the money that you have now, which is non-CARES Act money. It simply was made available because we use CARES Act money to fund salaries. So the money that's left now isn't CARES Act funding. It's simply additional fund balance in the general fund.
Right, and that's what it was given to us for, was for basically first responders.
But we used it. is what I'm
to
saying.
pay their salaries. But
Yes.
we didn't use, their salaries doesn't equal 1,300,000 like within a couple of months.
No, but over a year, it's more than
So what you did is you put it in the police department's fund.
right, because that's what it was intended to be
And
used for.
and we as a council got together and said that we would like for you to take that money and set it up here on this shelf that we called the CARES Act Fund, to where if we wanted to help businesses out that are bad, or whatever we chose to do with that at that time, that money was still available to use and spend, correct?
That's correct.
Okay.
Mayor, I just
Go
got
ahead.
one more. And back on the slide that you showed us that showed the payments that we've been making every year.
Yes.
I remember a number of years ago when we talked about extending that out to a longer period of time. I made the motion, after much discussion, that we go ahead and do that, but we continue to pay the higher amount, and that we look at it at the end of each year, and if we had the monies, we continue to pay that higher amount, but if we didn't, that would give us a little bit of a little breathing room. And I don't know, we've never discussed it again, to the best of my knowledge. Maybe it's been in the annual budget, but have we been paying the higher amount, or have we dropped down to a lower amount? That,
And Seal, I can tell you that no, we have not been paying the higher amount. We have been paying the percentage that PSPRS provides to us annually. And so the savings that we've seen in general fund has gone to the fund balance, and we've actually reached now our 50% fund balance in the general fund. And so that was also another policy that was created during the budget to any savings we had within the general fund, we would within 3 years try to bring our fund balance up to 50% of our operating expenses. And so we've now reached that capacity. And so
but the agreement that we had was that we continue to pay the higher amount as if we had not extended it out, and that would give us some breathing room if we had a bad year to pay a lesser amount. That was what, I made the motion, I remember what it was, and I'm just not sure that we've ever discussed where we're at every year.
Mayor, Councilman Seal, PSPRS was not able to give us what that amount should have been. They give us the 1%, and I know that we reached out to them at one point afterwards to see if they would provide us with the percentage that we would have continued to need to pay if we would have stayed within the 20, I believe it was a 25, or no, was it? Whatever the original amortization was.
15 or 20 years.
Yes, so they were not able to provide that with the actuarials that they were using at the time. I don't know if the new actuarials would be able to do that. They have created a modular that cities and towns can use, and we have the ability to enter in our data and add in payments if we would like to see what that would look like if we paid an additional $200,000 a year versus just paying their percentage that they're telling us we're required to pay. And so that model can be created with their spreadsheets now. Some of the issues with that was looking at that. It's still, like John, really, City Manager Casella was speaking towards, the large unfunded liability is so large that even a $200,000 extra payment a year would not bring that down substantially. And so we were not seeing any change in it, even by saying if we made additional payments. And so that's why a lot of cities and towns chose not to. As I would attend the GFOAZ conferences, a lot of cities and towns would talk about it, and they were not paying additional payments because they were still not seeing that unfunded liability reduce because it is so large.
And the CARES money is 1.3, not a million?
1.14 was the amount we received and used.
1.14. Now, does this tie the hands of future councils? Can they adjust this any way to make it more beneficial if something comes forward?
Mayor Councilman Lopez, the bonds, I mean, we can do various things. I think it depends on the bond, and if there's an early payoff provision that you can pay more in advance and pay it off early. In fact, we just got word Prop 207 may give us some additional funding. There's a provision in Prop 207 that may funnel money from the state toward the PSPRS unfunded liability, although the numbers are relatively small, so we'll have to wait and see when that kicks in and by how much. But I think that when you look at this chart, we already know basically what this PSPRS is telling us, and that's this line right here. That's their new actuarial number. So even as we get beyond 2027, before we hit 2030, there's going to be a significant rise in what they're asking us to pay. Now, regardless of whether or not we begin to pay extra money back here, this is something that is going to hit us, and it's going to hit us hard in the out years. So, Councilman Lopez, my question would be, would you rather leave this line for the next council or this one?
Now, you say projections are 7%, and if we only hit 4, that other 3%, is that what makes this a moving target?
Mayor, Councilman Lopez, there are two parts that make it moving target. One is the changes in the market themselves and the investments they make, and the other is changes that we have on our side, which the mayor was talking about, if we hire different officers or if there's some kind of activity that would expose us to higher levels of payout. So there's the internal part based on our hiring practices, and then there's the market part. Whatever the market is going to do, it's going to do regardless of what we do or don't do. And so the benefit of this is that you create predictability in the unfunded liability by taking it off the table, paying it off, and then anything you do regarding the market is done in real time in the given year you're in much smaller amounts. If you're carrying $13 million that also is subject to those market fluctuations, any percentage applied to that is going to be a big number. So the idea behind the bond is you get rid of that exposure, and the impact of those market fluctuations then are taken away from the unfunded portion and strictly apply year to year to what you're dealing with in real time, which would be a smaller number.
Yeah, and the mayor was talking about the legislature. If things start going good with them, they'll stick their hands in here again somehow, some way.
That's all they ever do.
And so, because we got to this because of economic downturns, questionable investment practices, poor management, that still exists. Who says that's not going to happen again? Did they go to a new person to handle this, and who's the same boxes are in there?
Mayor, Councilman Lopez, no, they did change personnel and they got a new actuarial firm. So there are new people there. Whether or not they'll fare better than those who came before them is another question that I definitely am not here to tell you one way or the other. If I could do that, I'd be investing some of my own money right now. But again, I mean, the bottom line is that we are sitting here with an unfunded liability. It's ours, we own it. There is a potential that the legislature could step in, but there's also the potential that there may be a push that there be some kind of forgiveness. If part of the legislation is that they're going to pay off unfunded liabilities, then it would be hard for me to assume, and again, I wouldn't want to speak for the legislature, but if you were acting fiscally responsibly, why would they penalize you? There may be an option there where we get forgiveness for our bond, and maybe we use those monies to pay the bond off. You know, again, we're trying to talk about the future. We don't know what that would be. But the one way that you could go at this, and again, getting back to Councilman Seal's point, is that if the municipalities statewide got together as a group and put something on the, it's basically the municipal policy statement is what they call it, and ordinances are provided, and then, you know, the league will then run with those and bring those forward as bills at the legislature. The way to approach it, if that is indeed the direction we choose to go in, that we need to be very active in talking to other communities, including places like Phoenix that have huge numbers,
Right.
and come at this from a group perspective where we're showing a unified front on this issue, because that certainly is a possibility. Now, how successful, I don't know. Again, we're going into this in a situation where the state has spent a lot of money on COVID. They're going to be in kind of tight straits, I think, so over the next couple of years. So again, how realistic do we think that is? Again, it's certainly an option. The only problem for us is we're sitting here with an unfunded liability that continues to grow over time, and even though we're increasing the payment to that, it's still getting bigger. So that is a concern. We know what we're doing now isn't working.
You say we can look into this like the WIFA fund, let you look into it with no obligation for this year's budget at this time.
That's correct. What we would do is we would bring, if council directs us to look into this more closely, we would come back with some solid numbers for next year's budget cycle that would say, here's the loan, here's the amount, here's the interest rate, if there's an interest in that, you know.
You know, to take a look at the bonding options and bring it back to the council, that's what I'd be looking for.
I know that, of course, prior to COVID, they were meeting on a regular basis, of course, in Prescott. And, you know, we had good momentum there for a while, and then we just hit 4 flat tires all at once. And so, you know, I think it's worth diving into, but I don't think it's worth, to me personally, funding right now. But I think it's worth us at least, if we wanted to process this, and you can definitely bring us something back for our, as far as I feel, as far as the next year's budget. But I would definitely cautious on the other side, because I think we should take the high road, like what you had said, and be serious on it and get some momentum behind us, because there's other cities and towns that are in the same boat that would be very helpful to drive numbers, just as, for instance, Vice Mayor and Brad asked for tonight, which was a special meeting to address the COVID pandemic or outburst, whatever you want to call it. Would be the same thing that we could do as far as this goes as well. So I think it has the possibilities if we're that serious about it. You understand? You know what I'm saying?
I do.
So, and the resolutions that.
Yeah, yes.
And bring those up. Who else has that idea to go forward too?
Councilman Seal?
Well, you know, and again, you know, we owe $12–13 million, which is a lot of money. But that's a relatively small amount compared to what a lot of these other cities owe. I mean, some of them owe probably $100 million.
I would think.
Or amounts, and so they ought to be on board with trying to get something through, and this might be a good time to try to engage some of them, back in something to go on a unified front to the legislature.
Okay, everybody okay? Go ahead, I'm sorry, can't see. Councilman McCoy?
I'm sure John knew I was gonna go there, but when you get these numbers, I wanna see you ask for a 15-year bond and a 20-year bond and see what the interest rates are, because I think they're gonna be less. And I'd just like to see how that pans out in comparison to what you're looking at, as well as take those payment amounts for all those different things and run them through her program she was just talking about, and see what that payment, how far that payment will go without the bond, just putting a larger payment toward what they're billing us for, I guess.
Right.
I'm torn on this, because I know if every person in the state were to do this bond and put the money in that account, the legislature would rob it blind.
Exactly.
I guarantee it.
Yes.
So
Exactly.
I don't know that there's really any incentive to pay it off, other than it'd be nice to have it paid off. And the payment keeps going up. So I'd like to see it, but I'd like to see more options than just the one you've presented. I want to see both directions, what it does if we go the other way, because I'm convinced, and I'm no financial anything, I'm convinced interest's going to go up here pretty quick. And this option's going to be off the table. So I'd like to see what all our options are on it.
Any other discussion? You got enough direction?
I do.
All right, thank you, John. Bring us to item 7.3, the minutes. Tammy, you look really pretty over there. You go ahead and.
Good evening. As you can see, Tammy's not here. I'm filling in for Tammy tonight. This is a request for the mayor and council to review and approve the November 9, 2020 council meeting minutes.
Second.
Any discussion? All those in favor?
Aye.
Any opposed? Motion passes. Item 8.1, ordinance 02, ordinance 02013. Mrs. Anderson?
Mayor and members of council, this is a second reading of ordinance 020-013, and a request for the mayor and city council to approve and adopt ordinance 020-013, an ordinance of the city of Safford, Graham County, Arizona, rezoning Graham County Assessor's Parcel Number 101-20-041 from AR Agricultural Residential, R110 Single Family Residential, to CMH Conventional Manufactured Home. And I'll be happy to answer any questions.
Ordinance number 020-013.
We have a motion to adopt ordinance 2013. Any discussion?
I didn't know did you have any questions, Mr. McGoy? Did you get them answered, or?
I have a little bit of heartburn with it, but I know that the Dolans are gonna do what they said they're gonna do, so I'm gonna shut up.
Okay. That's all I got.
Okay, we have a motion and a second. Any other discussion? All those in favor?
Aye.
Any opposed? Motion passes. Matt, would you please read that in?
Ordinance number 020-013, an ordinance of the mayor and city council of the city of Safford, Graham County, Arizona, effectuating a map amendment to the zoning map of the city of Safford, Graham County, Assessor's Parcel Number 101-20-041 from AR Agricultural Residential / R110 Single Family Residential to CM-MH Conventional Manufactured Home.
Thank you. Brings us to item 8.2, ordinance 2014. John?
Ordinance, this is the second reading of ordinance 020-014, land exchange of city parcel for a private parcel. Again, this is 735 Pine Avenue with 890 Central Avenue, and the properties have been valued. Those values and those calculations were vetted with the city attorney, who determined that the exchange of the parcels could be done simply on the value of the land itself. And so we're offering to just do an exchange of those two properties.
Entertain a motion?
So moved.
We have a motion and a second. Any discussion? Matthew, would you read in ordinance 2014, please? Oh, I'm sorry. I didn't take a vote on it, did I?
No.
All those in favor? Any opposed? Motion passes. Now would you please read it in?
Ordinance number 020-014, an ordinance of the mayor and city council of the city of Safford, Graham County, Arizona, authorizing a land exchange between the city of Safford and Arturo Manuel Gastelum by transferring ownership of a 9,034 square foot parcel owned by the city for a 10,500 square foot parcel owned by Arturo Manuel Gastelum.
Thank you. Ordinance 2016, Mr. Casella?
Council, this is the second reading of ordinance 020-016, regular council meetings / work sessions. And again, this was an opportunity, I thought, to make some adjustments. So I know we got twisted a little bit at the last meeting, so I want to start fresh and just lay this out as clearly as I possibly can. The code currently has in it the two meetings every month, the first meeting being an actual council meeting with action items, the second one being a work session. The MO that we use right now is we do 2 council meetings a month. So the first part of this simply says, let's adjust the code to fit what we're already doing. The second part of this puts language in there for work session flexibility. Now again, we're taking the second meeting of the month, we're removing that as a work session opportunity. So therefore I put standalone language for the work session And it's worded in such a way that you can call them when you need to, call them as long as you notice them like we would any other meeting. And I also added in, based on the conversation that we had at the last meeting, that we would make available a call to the public. So the language previously had a restriction that there would be no call to the public at the work session. And if you look at the new language, it says work sessions will be open to the general public. So if you choose to have a call to the public at that meeting, you can. And again, I would just say that we're not putting any language specifically in there as far as time. I would recommend, say, 5 minutes. But obviously, if we're in a work session, there's one applicant, you could provide them with more opportunity to speak. If you got a room full of people and you need to move things along, you could then restrict that time to something less. So, but this at least gives you that flexibility. So, one, we're just making the code be in keeping with what we're doing. And two, the language being inserted for work sessions is giving you flexibility so that potentially if you want to have a work session after this meeting, you could adjourn this meeting and we could go right into a work session and we could do items more quickly. If we're doing the budget and you want to have a Friday work session because we want more time, we could call a work session on a Friday. We could have it here. The language is open enough. Councilman Lopez, you had requested that we make it generic so we could have different places, and that's in here. So hopefully that was a little bit more clear than the last time I presented it.
Okay, everybody have a chance to look at it? Good? Entertain a motion.
So move.
Got a motion?
Second.
And a second. Any more discussion on 2016? All those in favor? Oh, I'm sorry, wait, Gene?
One discussion, and not particularly on this, but a lot of times when we have a consensus on things, I'm really not sure what that consensus is.
Yeah.
And I think we were kind of in that position, the last time, and so I think that probably for my benefit, if for no one else's, once we come to a consensus, somebody ought to state what that is so that we know that we're on the same
So John, would you
page with
repeat
it.
what you feel like you've heard from the council so we can verify that was that you just didn't listen to me or vice mayor or, you know what I mean?
Right. Okay, so Mayor, council members of council. The ordinance change that we are proposing is, one, taking out the second meeting and making, instead of a work session, making it a second council meeting, so what we've been doing essentially. And then making available new language that allows you to have a work session at a notice time, wherever and whenever you choose, whether it's after a council meeting, whether it's on a Friday, quarterly, whenever you want to call a work session, the language here gives you total flexibility in noticing that meeting.
And I believe you also stated that you worded it to where work sessions will be open to the general public, meaning it's open to the public, but at that time, the mayor can decide if it's going to be agenda, or in other words, you can comment on that agenda item.
This language would make it available at every work session, would be open for public comment.
For public comments?
Yes.
Okay.
I don't know if you say it at that time, doesn't it have to be published? If
Well,
you're-
I just wanted to make sure.
Mayor, Councilman Lopez, this is saying that every work session will have that as its format.
Yeah,
Every single
that's-
one of them, it's a given that that's there.
And you did mention a time limit from, 3 to or 5 and stuff, and nobody adhered to the 3-minute. You can't really, you can't even really cuss me out good in 3 minutes. So I don't know, maybe we need to revisit that 3 minutes and give them 5, but if we do, I do believe that we need one of those timers up there so that they could at least see that, and that might encourage them to wind it down, but depends on, I personally like the 3, and then if they're really respectful, we can massage 3 to 5, but at least needs to wrap up, because by that time it's over with. So I don't know, but that could be something the council, we can discuss on a little bit later time, okay?
Well, we'll be selecting work session items, and we'll kind of have an idea that people are going to talk to us.
Right. So with that, we had a motion by Vice Mayor, and we had Councilman Lopez second it. So are we in more discussion? All those in favor?
Aye.
Any opposed? Motion passes.
Find me a gong and I'll take care of 5 minutes.
Yeah, give you the dong, I'll give that sucker to you.
He takes care of me pretty good, so.
Whatever. All right, that brings us to item 9, which is
You gotta read it, you gotta read it.
Oh, I'm sorry, read it. Go.
Ordinance number O20-016, an ordinance of the City of Safford, Graham County, Arizona, amending Chapter 2.04 City Council, Section 2.04.090, regular council meetings, and 2.04.110 work sessions.
Okay, thank you. Bring us to item 9.1, P card report. Everybody have a chance to look at the P card report?
I had a question.
Okay, go ahead.
On page 26, under the utilities, I was just wondering, in a couple different places, okay, like Chrysler Pest Control, $210 at 1024 South First Avenue, then right there below it, it's the same, it's repeated.
Duplicate, yeah.
I was questioning that, and then there's a couple in here that are twice.
Vice Mayor, I can't believe that you didn't let Arnold bring that up. That's awesome.
I wanted to
I
beat
don't
him
have
to
to,
it.
yeah, I got it right here. It's Kelly.
Mayor, Vice Mayor Ortega, that charge for Chrysler was actually for bees, to abate some bees out of a residence where there were some bees around our utility boxes. This location was actually the location that was burned down by the fire department as a burn practice. So I'll have to ask why there was two charges, other than a brief conversation I had with Chrysler himself, stating that it was a large beehive, a lot larger than he believed to start. So maybe he charged us twice to make up for what he actually found.
Yeah, it'd be nice to,
I'll
if it's a
definitely look
bigger
into that.
beehive, get the, charge the right price at the time.
I'll definitely look into that and get back with you.
There were a couple of, go ahead.
No, the charges right there, I plan to bring up when we have our budget meeting, that on the contract that we have with some people on different things like this in the future.
Hey, Vice Mayor, you said you had a couple. Do you have?
What was, if you go through it, there's just a couple places where there were the same figures on the same date. And that's the only one I made a note of. But there's a couple more, I didn't write them all down, but if you just.
On page 28, Mr. Seals again.
Thank you.
On compliance samples. That's again, Mr. Seal, on page 28. It's Morgan. Page 28 again, they're repeats of this, almost the same verbiage of $1,191.75 for compliance samples.
So Mayor and Councilman Lopez, that's a Test America charge, is it? I
Yes.
believe? Yes. So this year, we did have a heavy compliance year, and each entry point to the distribution system, a well, we had to take certain samples. Each sample was identical from this well to this well, so that's why you see multiple charges, because one is per well. So I could do a better job at breaking it down, saying what well it was at. So what you're seeing is the exact same test for this well as it was for the next well.
Just different locations.
Yep.
Yeah.
Correct.
It looked like a typo right there. That's the one you were looking at, Vice Mayor?
Yeah, it probably was. I was just questioning some of them that were just,
Duplicates?
duplicates.
Yeah, that one was 5.
Huh?
That one was 5.
Yeah. There was one, I think, that was an air conditioning unit, but that's way back up on 24, and it's in the P cards, and it's for $9,843.60. I don't know how we got over 5,000 category, and then that one.
I knew you would not let Morgan feel bad about being the
Yeah,
only
okay,
one. So,
yeah, gotta get you up there, Mr. Henry.
I knew this one would come up. This is due to training some new staff in the admin department. We actually got 4 quotes on these air conditioning units. We bought 4 last year. This is the same company we used to get the AC units for the shop. Got them for the warehouse this year. I actually have 4 quotes attached with this receipt. This was the low quote. The others were 12, 13, 15,000. So typically this would be put in as a check request, but new staff didn't know the rules and paid with a P card, so figured I'd need to explain that to you anyway. So won't happen again. Can't promise that, but
I may not catch it again.
that's what happened on that one. And we did have the 4 quotes. We did go out to the procurement policy to get the quotes for that. So
But thank you, sir.
you're welcome.
That's all I have, Matt.
That's all? Okay. Just a reminder for department heads, just to give you guys a heads up that, try to shop as local within Safford as possible on any charges that you can. I realize that big stores might have a little bit more, but, we can try to keep our local economy going just as good too. Expenses over 5,000. Everybody have a chance to look at that one? Okay, I'm gonna go on to revenues over 5,000. Okay, last call. Going on to item 10, announcement of current events.
Friday, I'd like to thank Matt for getting me set up for the Siegel meeting last Friday. He did a good job, otherwise I'd still be playing with my computer trying to get hooked up to it. But I think about the only thing that really came out of it, right, we all should be a little concerned of, it's kind of like the word was mentioned about the state robbing money. It could happen again to our HERF fund. It just kind of sounds like they just may take some of that money and put it back to the general fund. So, and that's our, that's our roads and highways. So.
Vice Mayor, with that, can I talk with him? Do we need something from, like, the city saying, hey, leave our money alone, leave our HERF money?
We can do that.
But I mean, you tried?
It's a problem every year.
It is.
It seemed like it was gonna go away this year, but it seems like it's resurfacing, so.
So would you like something from us too?
Sure.
Okay.
Maybe we can touch base.
Don't hurt, right?
Touch base with Siegel on it and,
Okay.
yeah.
All right. John, will you meet with with the Vice Mayor and see what he needs on that to make sure that we get the right language on there and everything, so it at least looks good.
Okay.
Councilman Lopez?
I guess I had an email today that we're gonna light the tree Friday, and it was,
This Friday?
yes.
Okay.
And the message was real generic, we're gonna have it and stuff like, it doesn't say anything about what the parameters are gonna be there, like wearing the masks and things like that. I don't know that that's how it's going out to the public, or what,
Are we still meeting at the courthouse at 5:45?
Yeah. And I don't know if that's the place we're advertising, or it was just an invite to us or not, but I looked on our website to see if there was an invitation, and I didn't see one there. So,
I had slight conversations, but I think it's downsized completely.
Yeah.
I know the light parade has been canceled, but it wasn't due to COVID. It was due to the participants of the floats. As far as I understand, now I could be speaking totally out of context, but from the information I gathered was that it was lack of people participating. Correct, John? Did you hear that from Downtown Association?
Mayor Counts, I did hear something to that effect. Danny Smith had said something to me. He called me on the issue, and he mentioned they were having issues getting floats.
And that they were still working with the tree lighting, but downsized it, and because of the outburst, and but still wanted to, still kind of trying to bring in a smile on the outburst of a time right now. And so I believe that is still moving forward.
That's
but
correct.
I believe downsized.
Yep.
Did that? I don't know that answered anything,
yeah,
Councilman Lopez.
well, no, it just, people don't know what's going on.
So,
I do believe that was an invitation specifically to politicians, because it told you.
That's you.
It told you if you wanted to ride the fire truck over there, where to meet and what time and everything.
You're driving, right?
I've not been instructed.
Mayor, I have one thing. I'd like to say thank you to Mr. Casella and Director Henry. Good job on that graffiti behind Roads Enterprise and what was the other place? Extreme Martial Arts.
God,
So I want to say thank
yeah,
you for
that was
picking that
one of
up.
them.
So
Yeah.
when you guys were being vigilant, so thank you.
All right, anything else on announcement of current events? John?
Mayor, members of council, I just wanted to remind you and announce that I did get the link for the survey questions for the workshop in January. So I'll be sending that out. I'll wait till next week, get by Thanksgiving. And then I scheduled the workshop for January 15th. Councilman Hemphill wasn't available on the 7th, so I moved that so that we can make sure we have everybody there. So anyway, next week I'll send out that email with the link.
It's special. You got your own day.
And then they'll use that information later on to then work on the workshop, which will be January 15th. So if you guys would be so kind as to RSVP back so we know that you're going to be there and we can plan accordingly.
Okay. Report on operational items. Think we have anything?
No.
Okay. Before we adjourn, I do want to say a little bit on, back to the reflection of the COVID, is just to say, please be respectful of those who choose to wear a mask and those who don't. I will do my part as mayor of Safford to mask if I cannot maintain a physical distance of 6 foot. Please remember, I'm human, and I may forget, but I will strive to do good. So with that, Vice Mayor?
What time is it?
It is.
Let's go home.
All those in favor?
Aye.